Welcome back, everyone. This is our Eye on Vision segment. We have Dr. Mehta joining us again. Thank you for coming in once more.
Thanks for having me.
We need some more info. This time, retinal detachment. To me, this sounds very serious.
Yes.
Do you lose vision if you have a retinal detachment?
Yes, you can, as a matter of fact. Retinal detachment, basically what it is the retina in the back of the eye is like the light-sensitive tissue, and it's responsible for our sight. It's like the film of the camera. And with the retinal detachment, what can end up happening is the retina can peel away from the back of the eye and cause a partial, or sometimes if it's allowed to continue, it can cause a complete loss of vision if not treated.
Oh my gosh. Now, is this very common? I mean, would you know, is it an external injury that causes this? Or would a person know if they have this or not?
You know, typically people do know because, like I said, it causes loss of peripheral vision. But most often it's actually not an injury or a trauma that causes this. It happens spontaneously. And there are certain people that are at increased risk for developing retinal detachments. And they could wake up one morning with a partial loss of vision. That's when they know they have to come in and see us right away.
What is the risk group? Is it age?
Well, age is one of them, actually. It's typically not that common in people under the age of 40.
Okay.
So above 40, then we start to see what ends up happening is the vitreous gel in the back of the eye starts to pull away from the retina as it liquefies. And when that happens, that can actually tug on the retina and cause it to tear. And there are some people that are, like I said, higher risk for developing that, specifically people that are high myopes, which basically means that they're very nearsighted. And people that are very nearsighted have thin retinas in the periphery. So when that jelly goes to separate from the retina, it tears it in one of those thin areas. And that's what leads to detachment. Is
it hereditary at all? Does your family history have
There is
any?
a family history associated, although I will tell you that most people that get a retinal detachment don't have a family history. But there is a genetic link, and some people, especially since myopia or nearsightedness is genetic as well, and that is one of the risk factors for retinal detachment.
Okay. Now, is this something during a regular eye exam the physician can see?
Yeah, absolutely. So, if a patient comes in with flashing lights and floaters, and those are the two very common presenting symptoms, along with the peripheral shadow or curtain over your vision, we can take a look in there and find out whether or not there is a retinal detachment. And then usually if we see a detachment, which is basically fluid under the retina, we'll see an associated tear. So a retinal tear is really what leads to the detachment.
Okay, and now, so if you do see little floating things, we should let our doctor know about that?
Yeah, so if you suddenly have an onset of floaters or flashing lights, or peripheral visual field loss, come in and see us right away so we can take a look.
That's not something to wait.
That you do not want to wait on that, because the sooner we can treat that, the more likely it is that we'll be able to regain a lot of vision. And sometimes we can regain all the vision if we get it fast enough.
Really? It can be? Okay, so how is it treated? With surgery?
Yeah, so there are actually 3 different ways that we treat it. And I won't get into the details of all of them, but yeah, it is a surgical procedure where we can well, actually, one of the ways we treat is we wrap a little silicone band around the eye under the muscle insertions of the eye, and then we actually squeeze the eyeball with that silicone band, and that indirectly relieves traction on the retina. So it sounds barbaric, but actually
it works. If it works. If it works.
It works.
Okay.
And then the other way is a procedure called a vitrectomy. We make 3 tiny incisions into the white part of the eye. We clean out the gel that caused the detachment, and then we drain the fluid from underneath the retina. And then we seal the tear down that caused the detachment with laser. And then we put either a gas bubble or an oil bubble in the eye to push the retina back into place while the laser is sealing it down.
Wow, so many advancements in medicine and in the eye. It's amazing.
It's pretty cool what we can do these days.
It really is. It really is. Well, thank you so much. So vision can be restored with treatment.
That is correct,
so
for the
most
part. Yeah, exactly. But the sooner, like I said, the sooner that we can diagnose and treat it, the more likely we'll be able to regain the vision back, or at least as much vision as your eye is willing to give us.
Sure. So don't wait if you have a problem like that. Okay. Thank you, Dr. Mehta.
Thank you.
If anyone has more questions, can they contact where you're located?
Absolutely. Just contact us at the Retinal Consultants of Arizona. Our main office is in Phoenix, and we have a website that you can go to, retinalconsultantsaz.net. So just go to that website, and they'll give you plenty of information about a retinal detachment, and also give you some contact information.
Great. Information is king. Excellent. Thank you. We'll see you next time on Eye on Vision. We'll be right back.